Over 100 million Americans suffer from chronic pain. That's 1 in 3 Americans, not including children. Chronic pain, also known as persistent pain, is a disease defined as pain lasting over 3 to 6 months or surpassing the time of normal healing. The most common form of chronic pain is lower back pain. Chronic pain is a complex condition that can develop in several different ways. It can stem from a physical injury, such as a bone fracture, or from a surgical procedure. It can be multifactorial, meaning a biopsychosocial phenomenon. For example, a person with lots of stress tends to develop chronic pain more than a person without stress. Or the cause might be unknown, as in the case of fibromyalgia, where the cause of pain is unidentified. Chronic pain can interfere with lives in several ways. It can impact a person's work, family, social life, and their overall enjoyment and quality of life. It may lead to social isolation, reduced concentration, reduced activity, reduced productivity, and ultimately it may lead to disability. A lot of times, chronic pain is an invisible illness. You may wonder why. This is because people with chronic pain may not have an explanation for their pain or may be unaccepting of their condition, and so they hide their illness from others. They may feel like they are a burden to family and friends. In many cases, there's no easily visible signs that show that a person has chronic pain. As pain is difficult to diagnose, it is also difficult to treat, but that does not mean we cannot help those who suffer from chronic pain. There are many different ways to manage chronic pain. The obvious option is pain medication, but a lot of times pain medication does not alleviate the problem completely. Often, the best way to approach chronic pain is with an interdisciplinary team. This may include the primary care physician, a physical therapist, a psychiatrist, and a neurologist. Complementary and alternative methods that focus on wellness, such as acupuncture, chiropractic, mindfulness meditation, yoga, and hypnotherapy, may also be beneficial in relieving the overall burden of chronic pain.